Meet one of the Grand Strand's pioneers in plastic surgery. Coming up next on Carolina People. Good morning. Welcome to Carolina People. This morning we're at the Fox 43 studio. We're focused on plastic surgery, and we're visiting with Dr. Stephen White of Carolina Coastal Plastic and Reconstructive Surgery. Good morning, Dr. White.
Good morning. It's good to be here.
Thanks so much for coming in before heading into the operating room.
Well, this is what we wear every day, different colors. But since we're in the operating room a lot, we just wear this to work every day and proceed from there.
Thanks for popping in. Absolutely. That's a great looking outfit. You also say you mix up the colors.
We mix up the colors. Sometimes people are color coordinated. It's hard to keep the surgeons color coordinated because you never know what color they're going to wear. But basically, we try to get them embroidered, you know, and that sort of thing. We have lots of pairs. They're comfortable. And when you're working with patients both in and out of the operating room, you know, you're dealing with body fluids and things like that. And certainly don't want to wear a coat and tie because you'd be ruining one every day, I think.
Right. Now, when you say you're in the operating room, is there a central location, or do you travel around the area and into other counties, or stay here in Horry County, or different facilities?
Actually, I'm credentialed to do surgery even as far as Shaw Air Force Base because I'm in the Air Force Reserves. So I will do surgery up in Sumter at Shaw Air Force Base. But the main place that we do surgery is our surgery center on 21st Avenue, which is Carolina Coastal Plastic Surgery. Okay. And we do about 90% of our surgery there. We also do surgery at Grand Strand Hospital, Loris Hospital, mainly at Seacoast, Conway Hospital, and now down in Waccamaw. So we're all over the place. But 90% of our surgery is done at Carolina Coastal Plastic Surgery on 21st Avenue, and it's you know, it's all outpatient surgery.
Right. That's next door to the Pelican Stadium.
Correct. So it's an easy way to find it because you just tell people to go to the Pelican Stadium and look to your right, and there we are.
Right. Very easy. Now, of course, real quick about yourself, Dr. White. Are you originally from the area?
I've been in Myrtle Beach since 1972. My father was transferred here from Virginia, and he became the base commander at the Air Force Base, which is the land we're at now.
Right.
He retired in '74, and he was the first city manager of Myrtle Beach, and then he went on to be Horry County treasurer and all that sort of thing. So because of that, I stayed in Myrtle Beach since 1972, but I've been in the Air Force, traveling around the world. I lived in Germany for 3.5 years, and then when I left Germany as a plastic surgeon, I came to Myrtle Beach because my parents lived here, and I started practice here. I was the second plastic surgeon in Myrtle Beach.
Is that right?
That's correct.
Who was the first?
Ken Smith, and he is now retired. He was prior military, too. He was in the Navy and retired from the Navy, went into practice in Myrtle Beach and in 1986, and I came in 1989.
Son of a gun. Now, how many other plastic surgeons followed you here since '89?
Well, actually, there's 5 plastic surgeons, and so I have a partner, William Young. He came in '95, and I think Dr. Go, she came in about '91 or '92, and then Dr. Kozart came and Dr. Quirk. So we have 5.
5 serving Horry County, essentially.
5 serving Horry County, yes, sir.
That's amazing. Now, of course, when you talk about serving in the Air Force, had your medical degree been received prior to going into the Air Force, or was that during your Air Force experience?
Yes. Actually, I was on an Air Force scholarship to go to medical school, and I graduated from medical school in Charleston, South Carolina. And that's when you get your medical degree. But right out of medical school, I went into the Air Force. And I went into a surgery residency program at Keesler Air Force Base in Mississippi. And then from there, I transferred to Spartanburg Regional Medical Center in Spartanburg, South Carolina. So I lived there for a little while, for about 3 years, and then went to San Antonio, Texas to do plastic surgery residency. But the whole time I was in the Air Force. And even as a civilian in Spartanburg, I was paid an Air Force salary, which was pretty nice at that time because surgery residents typically aren't paid very much, and actually the military people are paid much better. So that was an advantage for everybody. And so when I left San Antonio, I went to Germany. I was transferred to Germany in Wiesbaden as the first plastic surgeon in the European theater for the Air Force they had ever had. So I was quite busy for 3.5 years because we got patients from all over the European theater, including Africa and we got a lot of trauma victims from all the hostage crises. That's when all the hostage stuff was going on.
Oh, yeah.
With Pan Am and, you know, the terrorists. That's when terrorism was starting to really pick up.
Right.
And their injuries came to our hospital, and we took care of them. And I was the plastic surgeon there for reconstruction.
How exciting to have been a part of that to help so many of those folks through such a terrible circumstances.
It was a great experience for someone young out of their plastic surgery residency. I was operating 5 days a week there, and that was almost unheard of because that was a very choice assignment. Of course, Europe is beautiful, and a lot of surgeons like to go there and do their operating, but they also like to travel around, and I was always operating.
Yeah, working all the time.
Yeah, and that was, as I look back on it, I kind of wish I'd seen more of Europe at the time, you know.
Gives you an opportunity to do that, hopefully, after you slow down a little bit. If you're heading into the operating room all the time, you must still be dang busy.
We're busy, but it's a different sort of busy now. We're doing a lot more cosmetic surgery now. Back then, I did a lot of cosmetic, but a lot of reconstructive too. And our practice has shifted to being, my practice personally has shifted to being about 80% cosmetic and 20% reconstructive. I'm also a hand surgeon, so I do hand surgery also. But it seems like mostly, you know, with all the hoopla now about cosmetic surgery, it's really been busy doing that, and that's been a very good thing for our practice.
We sure want to highlight that. Of course, we also want to thank you again on behalf of the American Heart Association. Part of the reason having you in today was tied into your original amazing sponsorship, a gold sponsorship, I think a $5,000 sponsorship to help support the American Heart Association in fighting heart disease and stroke in this most recent 10th annual Heart Ball up at the Marriott. So thanks again. That was a big commitment on y'all's part. What do you think prompted that?
Well, you know, the Heart Ball is such a big thing, and they always do it so well. And they have neat locations every year. So it's the location, it's the benefit, and I wanted to treat my office. I wanted to get a table, and I have 13 or 14 people that work for me, and I wanted to do something for them, and I thought it's a nice thing for your employees.
Right.
It's a good benefit. It's a good charitable thing, and the it's always fun. I mean, so that's what kind of was the impetus for us to do it.
That's fantastic. Dr. White, I think a lot of viewers would be interested in what it was like coming here in '72 with your dad as the base commander, being here on the former Myrtle Beach Air Force Base now, obviously our studio in the former Air Flight Simulator. I live here on the former Air Force Base out in the old Air Base housing, so I'm interested, but I bet a lot of viewers would be interested in what it was like being the child of the base commander. Tough?
He was, yes, I can remember getting a traffic ticket, and by one of the air police. I was driving 28 and a 20, and he gave me a ticket. Normally you just turn it in and you get scolded a little bit, but I had to go before the judge, the base judge, just to set an example, you know, sort of thing. But it was great, you know. Back then I was on the golf team for the Citadel, and as base commander, he was basically a member to just about every golf course around here as an honorary member. So he never had time to play, but I used his membership to go around and play. So it was great about that. Yeah. And it was just a wonderful thing. It was a beautiful base back then, and I miss it. You know, I really do. And I'm glad to see that driving around here with Carrie, my patient care coordinator, I see that they're really developing the land in a nice way and that sort of thing, because it was a beautiful air base.
Oh yeah. Had you not been on the base recently?
No, actually I was here maybe a month ago, and I actually got lost, and I lived here for
that's right
2 or 3
years.
All
the new road work through here.
Yeah, I couldn't find my way around. It's changed so much.
So you have fond memories of those experiences. So you actually arrived here, I guess, in the latter part of high school then.
Got here when I was
not to date you there, because we're 72 and it's 2004.
But I was in college, you know, early years at the Citadel, and so yeah, it goes way back, and I played golf here a lot, you know, on the base golf course, and they had a great. I can remember when it was 9 holes, and then they developed into
Whispering Pines now, right?
Developed into 18 holes, and it's a great place.
You have brothers and sisters?
I have a sister. She lives in Maine. And all kinds of nieces. She has 5 girls, so I've got 5 nieces.
Wow.
So we
5 nieces.
got
What's
big
that
family.
like being Uncle Stephen to 5 girls?
Well, they come down and I treat them like queens. They're great girls. They really are, and they've got good education. One's a nurse. The oldest one is a nurse, and the other ones are heading in that direction. It looks like.
You know, there's so many aspects. Obviously, when we think of plastic surgery, so much going on. Plastic surgery is head to toe. I mean, this is your entire body. Parts of, folks can have things done cosmetically or otherwise, or for very important, as you mentioned, reconstructive. And I know the title of, or the name of y'all's business, Carolina Coastal Plastic and Reconstructive Surgery. I mean, that's a very important component of what y'all do.
Right. One of our big operations we do on the reconstructive side is skin cancers, and a lot of people don't think about that, but a lot of people have a significant enough skin cancer to where they need a plastic surgeon to reconstruct them. So we'll take off the skin cancer and reconstruct them on the same sitting, and that's a big thing, and that can be done at the surgery center, in a local procedure. But hand surgery, breast reconstruction, lower leg reconstruction, accidents, facial fractures, scar revisions from accidents, things like that all fall in the realm of reconstructive surgery.
That exciting aspect there, as I sit here and just think about that briefly, where most medical professionals are working on internal aspects, the parts of the body that need to be healed from the inside out. Wherein you're a two-pronged approach. The patient's so thrilled not only to, when you're talking about skin cancers, not only to have the healing associated with that, but to have that at some level cleaned up. I mean, it's a two-pronged approach and a real beneficial aspect.
And you have to know something about the internal part of the patient,
Sure.
as you said, because in order to be a plastic surgeon, most programs require you to be a general surgeon also. So we go through that training first, then we can go on to plastic surgery.
Right.
So it's usually an 8-year training period after medical school to be a plastic surgeon. About the longest you have. I think neurosurgery's up there too, being a brain surgeon sort of thing. So it's good to have a knowledge of what goes on inside the patient, and so you can coordinate that with what you do in the plastic surgery category with them. They're just better plastic surgeons are just better plastic surgeons when they've had that kind of training. But yeah, you have to read it all, and we do operate on the head to the toe, pretty much.
Dr. White, we're talking about 16 years of post-high school, 12 years after college. You're talking about the four years of medical school and then another 8 years?
That's right, 12 years after college.
That's incredible.
I know, you really don't start working until you're 33 or 34. So if you want to be in a training program a long time, this one's a good one.
That's right. Or for people who are living off their folks or otherwise,
That's right.
to be able to take advantage of for as long as possible.
And you always have somebody looking over your shoulder a little bit when you're in a training program, so maybe you're kind of delaying that,
Right.
being out on your own. I don't know. But
What's the most exciting aspect of being a plastic surgeon for you, Dr. White?
it's changed over the years. I get a thrill now out of seeing how happy the patients are.
Yeah.
In plastic surgery, you have to have 99.9% of your patients have to be happy, because if you're only 99% and it's 1 out of 100 that's unhappy, boy, you hear more about that one person than you hear about the other 99 that were.
Oh, yeah.
So you really have to hit it on the nose just about every time. And it's always thrilling to see the patients leave and how it changes their lives and this sort of thing. It's really, psychologically, it really increases their self-esteem astronomically.
I was thinking...
It's amazing. And, we're all family. We come in, they give you a hug, and hug the girls and the techs and everybody. We just all feel close to our patients because they feel they can come to our surgery center as a safe haven or a sanctuary. They can tell us some things about themselves that they know will not go anywhere, share some personal things, and tell us why they're having the plastic surgery. And it's really a neat thing.
That must be very uplifting. What about the aspect, just a point of interest, what would be the percentage of, without naming names or anything, but the percentage of women to men, male to female? Would it primarily folks that have men gotten more interested in possibly changing the way they look or getting reconstructive surgery?
It's creeped up. Greg, it's probably 24% of the patients I see are men, and 75% are women still. But that's a lot more than it was, say, 15 years ago when it was 10% men and 90% women. So it is creeping up. It's more acceptable. People are seeing that you can have plastic surgery through minimally invasive incisions. We're trying to decrease the downtime, minimally invasive incisions, and still do the same surgery. The extreme makeover things that are going on, we do that all the time. I mean, that's just a routine thing for us. So most of us never go home and watch the programs
Stuff on
TV.
Fox, that's right.
Oh, there's nothing wrong with that. But I mean, it's just, we do it every day. So the last thing you want to do is watch it again on TV at night.
What do you watch at night on TV?
Fox News, actually.
Oh, great.
I
Good
do.
man.
I'm addicted to Fox News, and that's about it, because by then I'm asleep.
That's a competitor of mine, kind of. They use that same brand, but another cable network. It just takes viewers away from us, but I'm excited that you're at least tuning into the Fox brand.
Yeah,
That's great.
yeah.
When folks hear about liposuction, I think there are oftentimes fears associated with that, but I think it seems like it's very practical. Is liposuction safe?
Yes, it is in the right hands, and again, it's knowing your patient and knowing your limitations. They've had, in the news, and this is no secret to anybody, they've had some problems with liposuction in other states, where by certain physicians, whether they be plastic surgeons or not, because other people do plastic surgery that are not plastic surgeons, that maybe have been done too much on the patients have been followed adequately, and stuff like this. So you really have to take the patient preoperatively, know what they are preoperatively, make sure that when they go to surgery, it's safe for them, have the surgery, know your limitations in doing their surgery, and then after surgery, follow them very closely. We follow our patients for lifetime. So, but as far as liposuction goes, the critical time is usually the first 48 to 72 hours after liposuction, when you have to make sure that they stay well hydrated, and it depends on how much liposuction that you take off, so to speak. It's a very, very effective procedure. It's combined with a lot of other plastic surgery procedures that we do, and it depends on a lot of things, and we give them a pretty straightforward answer on what they need.
Now, do you often work hand in hand with dermatologists, Dr. White? Do folks turn to you? I think about myself growing up as a child with cystic acne and severe acne on my back, always being real sensitive about it, and thinking oftentimes dermatologists couldn't help on the side of helping to remove deep scars or otherwise from acne. Do you ever work hand in hand with dermatologists?
We have a number of excellent dermatologists in Myrtle Beach, and they will they'll handle a lot of the skin cancers and things themselves. But when they find that the patient actually has to have some reconstructive surgery at the same time, they'll send them to the plastic surgeons regarding that. And in terms of acne scarring and things like that, yeah, they'll send them to us, and so we can do some laser resurfacing or something to make them have smoother skin and whatnot.
Oftentimes you're probably seeing patients who come in to have combined surgeries. What are some of those common combined surgeries that folks would be familiar with or may not be familiar with?
Well, one operation we call is a blue plate special. This is when you come in, you have your entire face redone. This could be a facelift, a brow lift, eyes, maybe some facial fillers done. There's 2 new facial fillers out now. They tend to last longer than collagen. Those sorts of things. And those procedures can take 5 to 6 hours. They're done under sedation. You don't have to go completely to sleep. And it completely rearranges your entire face. And it's pretty dramatic. Liposuction's included in that. In terms of body contouring, just the last couple days I've done body contouring on a couple patients where you completely change the size of their breast. You do uplifts. In terms of their abdomen, we combine that with body contouring, giving them a waist back, sorts of things like that. And that's a 4 or 5 hour procedure. Something that's real popular now are patients that are losing weight through the gastric bypass, so they have a lot of excess skin and loose muscles. That's a big thing, and we're doing a lot of body contouring on those patients, and they're just getting dramatic results.
Oh, yeah. Now, how does that work when for instance, when the contouring, you're hopeful, obviously, you won't gain any of that weight back. How does that work? Are there fears of folks, if they're going to lose that kind of weight, they may gain them back, and that if they do any contouring, then that it would be difficult? Or does the contouring help ensure that they're not going to gain weight again?
They're not going to gain weight back in the areas that they had liposuction.
Okay.
They may gain a little bit, but they're going to have to change their eating habits in a negative way in order for them to gain weight. And we counsel them on that. You know, if you get down to a certain weight and you like that weight,
Right.
that's the weight we're going to work with.
Right.
And let's say we take 10 pounds off of liposuction and body contouring, and if they weigh 150 pounds and after 3 months they weigh 140 pounds, then we know that they have maintained their weight because we took 10 pounds off them.
Right.
In 3 months, if they come in and weigh 150 pounds, then they've gained 10 pounds, even though that was their preoperative weight. So we counsel them on that, too. And I have them come back. I say, okay, you've got to come in every month and weigh in, and they do it, and they don't like to do it, but I make them do it, and we get them back on that sort of proper eating and that sort of thing. Because there's a million diets out there, and we've got a standard one that we talk to patients about.
We got about 5 minutes, Dr. White. It's so exciting when you think about all those aspects. Obviously, to a great degree, folks often think of plastic surgeons, they relate to breast implants. I mean, are breast implants safe?
They're very safe. They've always been real safe. They haven't always held up in terms the silicone implants used to rupture over a period of time because they're like any foreign body, they will wear down and they'll rupture. Now that the silicone implants right now are on a trial basis. That means that you can still get them, but you have to have an indication to have them, and you have to go on a study, which is fine. But we're finding out that they are very safe. That's a short story of a long discussion. But the majority implant we're using now is a saline implant. It's a silicone shell filled with salt water. There's different shapes and sizes that we can use, and we measure the patients according to what their body anatomy is. The thing about a saline implant is that if it goes bad, you're simply going to go flat. It's going to leak out. What leaks out is water. So you don't have anything to worry about. You just need to go back to surgery and have a new one put in, and that operation is always much less than the first one.
Right.
So it's a very safe operation. People ask me how long do they last, and I say, well, they can last 1 year, they can last 30 years. Who knows? It depends on wear and tear of the implant. The implant companies are very good about giving you new implants if you have them done. So they have an excellent insurance program regarding that, and it's really that is one of the very satisfying operations that we do. Now, the most satisfying operation, you might wonder what that is a breast reduction, believe it or not. 100% of those patients that have breast reduction are happy because of the weight of their breasts, they have neck pain, back pain, rashes underneath their breast, shoulder pain, and all those symptoms go away. And I've been doing that operation for 25 years. We do it through limited incisions now, and those patients are happy 100% of the time. It's amazing. It doesn't mean they don't have complications, but they're happy when everything is said and done and healed. They're very happy. It's a great operation.
That's fascinating. Now, for viewers who may be interested just learning about it, does it have any effect on mammograms, or would it have any negative effect on getting mammograms, or would it have any effect on any of the self-checking or self-checking for lumps or otherwise?
Actually, in terms of breast augmentation, you can palpate your breast easier if you have an implant in, because you have a platform to examine your breast. Instead of examining against your ribs, where your ribs are hard, then you have the intercostal muscles. It's kind of hard to know where a knot is and where you don't have one. So it's been shown in studies with patients that have breast implants that they can actually palpate lumps in their breast easier. The implants don't cause cancer, and you might have to get 1 or 2 more views in a mammogram, but that's with the advanced radiology that we have, it's not an issue. In terms of breast reduction, when you take the whole breast apart and make it smaller, you do put scar tissue into the breast, but that scar tissue can easily be delineated difference from a breast cancer itself. So that's not an issue with an experienced radiologist.
If you hadn't had that 8 years after med school focusing on plastic surgery and reconstructive surgery, Dr. White, what do you think you'd be doing? What do you think you would have gone into?
I don't know. Nowadays, the climate going into medicine is a lot different than it was when I went into way back then. So I would probably do computers or something like that. Who knows? But I do love what I do. It's just such a long road, and the bureaucracy in medicine has been a problem, and it's affected a lot of doctors, and they kind of have a little bit of bad taste in their mouth about it. And I think things are going to have to be changed. People need access to medical care. That's an issue. The cost of medical care, reimbursement. You know, we want to make sure that everybody has an access to medical care, but it's really on the backs of a lot of doctors, and that's been kind of a hindrance.
I think you answered it earlier, but I think a big question would be, who's been the biggest inspiration for you? Do you have an inspiration? Maybe your patients, seeing those changes, maybe early on, somebody who prompted you to get into medicine and later really serving others through medicine.
I had an English teacher in high school that was a big inspiration for me. I had a fighter pilot who was in Vietnam. He was a big inspiration for me. Parents, of course, were different people throughout my life. I'm the only doctor in my family, so I kind of went a path that no other people have gone in my family, and it's been a good. I wouldn't do anything different because it's hard to imagine doing anything else. But I know that I sure wish I knew how to work the computer nowadays, and we just don't know anything about computers, and it would be nice to know more about that than what we know now in the office.
We'll have a talk with Carrie about that. Absolutely.
That's right.
Thanks so much for being with us this morning.
You're more than welcome.
Absolutely.
My pleasure.
Stay tuned to more Carolina People with Dr. Stephen White coming up next. You heard him talk about those inspirations, his parents at an early age being here and sneaking onto golf courses thanks to his dad's privileges at so many area golf courses, arriving here at Myrtle Beach in 1972. That's more than 3 decades here. 4 years of college, 4 years of medical school, 8 years focusing on plastic surgery, reconstructive surgery, truly serving others. Think about that, truly serving others. They're open from 8 to 5 many days. Tuesdays, I think he talked about off camera, being around there much later. If you're heading out to a Pelicans game, they're right next door to Coastal Federal Field. On a Tuesday, you can pop by. You may bump into them. Any day you can pop by there, 21st Avenue. Dr. Stephen White.